A nationwide Salmonella outbreak is currently impacting primarily residents in California, and the situation is serious enough that everyone with eggs in their kitchen needs to pay close attention. But here's where it gets controversial. Despite widespread egg recalls, many people remain unaware of how to identify potentially contaminated eggs or underestimate how dangerous Salmonella infection can be. Let's break down exactly what's happening, how to spot the affected eggs, and what symptoms to watch for if you've possibly been exposed. The eggs linked to this outbreak were sold across California and Nevada under several brand names with their sell-by dates extending through September 16. The Centers for Disease Control and Prevention, CDC, strongly advises that anyone who may still have these eggs at home should dispose of them immediately to avoid the risk of infection. Moreover, if you or anyone in your household begins showing symptoms of Salmonella poisoning, seeking prompt medical care is crucial. So, how can you tell if your eggs are part of the recall? The eggs in question come from Country Eggs LLC and were marketed as large brown, cage-free eggs under the name Sunshine Yolks. Sometimes, these eggs might also have been labeled omega-3 golden yolks, making it trickier for consumers to realize they're part of the recall. These eggs were shipped between June 16th and July 9th to various grocery stores and food service distributors. You'll find them packaged in cartons branded as Nagatoshi Produce, Misuho, or Nijiya Markets. One helpful identifier is the printed code CA7695 on the carton, and the affected sell-by dates range from July 1st through September 18th. If you want to be absolutely certain, the Food and Drug Administration, FDA, has published images of the recalled cartons, which can help you visually confirm whether your eggs are part of this health alert. Although many people don't usually check these details, it's important now more than ever. Now, if you realize you have these eggs in your fridge, what should you do? The CDC's guidance is clear and non-negotiable. Throw the eggs away immediately. You can return them to the store where you bought them for a refund. This kind of strict advice undoubtedly sparks debate. Some may argue about food waste or mistrust recall. For business owners or food service providers who purchase these eggs, the CDC stresses that you must not sell or serve them under any circumstances. Food safety is non-negotiable in commercial settings, and serving these eggs could result in serious liability issues down the line. What if you think you might have eaten one of these recalled eggs? The symptoms of Salmonella infection can take anywhere from 6 hours up to 6 days to appear after exposure, which means the source of illness isn't always immediately obvious. Common symptoms include diarrhea, fever, stomach cramps, and vomiting, but more serious signs warrant immediate attention. The CDC urges you to seek medical care if you experience any of the following: diarrhea accompanied by a fever over 102 Fahrenheit, diarrhea lasting more than 3 days without improvement, bloody stools, severe vomiting preventing you from keeping down fluids, or symptoms of dehydration such as dizziness, dry mouth, or reduced urination. For most healthy individuals, Salmonella infections clear up within 4 to 7 days without the need for treatment. However, the CDC highlights that certain groups are much more vulnerable to developing severe illness. These include children under 5 years old, adults over 65, and people with weakened immune systems. In these cases, hospitalization may be necessary, underscoring why awareness and caution are so important. And here's the part most people miss. Outbreaks like this remind us how much we rely on the safety protocols of food suppliers and regulators, but how often do we question or stay informed about recalls and warnings? Are we truly doing enough to protect ourselves and our families from preventable foodborne illnesses? This outbreak could very well ignite debate about egg production standards, large-scale food safety practices, and consumer responsibility. What do you think? Should consumers bear more responsibility for verifying food safety, or is it entirely on producers and regulators to prevent these dangers? Do you believe recalls like this receive enough public attention to effectively protect people? Share your thoughts and experiences below. you might help others stay safe or spark an important conversation.